Now, Singapore Today with Lance Alexander and Daniel Martin.
You've been hearing a lot about cord blood, the storage of cord blood in Singapore in the news recently. And of course, Cord Life, the cord blood banking service provider, saw some of its storage tanks being exposed to temperatures above minus 150 degrees. More than 7,000 of its clients were affected after some of the cord blood units were found to be damaged. This is an ongoing case, of course.
Yeah, to find out more about cord blood banking, let's speak with Dr. Tan Eng Loy, obstetrician and gynecologist at EK and EL Women's Clinic. Dr. Tan, welcome to the show. Maybe you can tell us more about what exactly is cord blood banking.
Cord blood banking refers to the practice where the cord blood of a newborn is actually harvested from the umbilical cord and is then processed and then stored in a cord blood bank, of which I think they are private cord blood bank as well as a public cord blood bank at the same time.
So this is done in the restructured hospitals as well?
Yes, it is. Right. So they are, as I mentioned, they are private cord blood banks as well as public cord blood banks. And the difference is that for private cord blood banking, the parents actually engage a private commercial cord blood banking company to actually store the blood stem cells, which are collected from the cord blood during the baby's delivery. All right. This is opposed to the public cord blood bank, where the cord blood is actually harvested from voluntary pregnant ladies at delivery. And similarly, similar process, right? They collect the stem cells, they are extracted, and then in this case, they are stored in the public cord blood bank instead.
Okay, maybe you can tell us a bit more about these stem cells being collected. What can they be used for?
I think the cord blood banking itself is not something that is really new. It's been actually in use for the treatment of certain blood cancers, and this actually started in the 1960s. All right, so I think recognizing that having matched donor cells is actually vital to the success of such treatments. So stem cell donor registries that stored stem cells from unrelated voluntary donors actually sprouted up in the 1980s. And the idea is to actually provide an opportunity for affected patients to actually find a potential match. And we do recognize that the likelihood of finding a match is higher amongst siblings, since they share similar genes. And so based on this understanding, families who can afford private cord blood banking, then, increasingly they chose to actually store the blood stem cells for their own families as a form of a kind of a biological insurance, right, should the need arise to use them in the future.
As opposed to the ones in the hospital where the match would be open for anyone that needs it?
Yeah, so this is where the difference between public and private comes in, right? So for the families, the parents who actually engage private cord blood banking companies to actually store the blood. So should there be a need to use these cells in the future for stem cell therapy, the family can then draw on these stored cells for their own private use. And for the private cord banking, basically no one else can use these stem cells otherwise, versus the public sector, right? So these are actually donated to the bank for everyone's use. And should any patient in the public actually require stem cell therapy in the future, but is unable to find a suitable donor, then the cord blood bank extensive library of donor cells can then be searched in the hope that a suitable match can be found.
Okay, we know that they need to be stored under very cold temperatures. How is that ensured?
Well, I don't know the full technicalities, but as far as I'm aware, the cord blood bank, there's an initial freezing temperature. I think they try to reach as low as minus 180 degrees in the initial freezing process itself. And subsequent to that, I believe the temperature is meant to be kept below minus 150 degrees Celsius. And I believe the majority of it is actually done using liquid nitrogen technology.
What kind of health conditions are we talking about? You said stem cell cancer treatments. Any specific types of cancer? Is this mainly for the blood type cancers or other forms as well?
Well, I think this is a better question for my colleagues who actually do pediatric hematology and oncology. All right, but I think the most common use, I think in fact the original use in the 1960s was for the treatment of leukemia. All right, so Others, blood cancers, I'm not so familiar with, but I do understand that majority of them are pediatric cancers. And I think that appears to be the main stream, the main established treatment, right, that is actually recognized. Now, of course, there are other uses for cord blood that has been proposed. A lot of excitement on whether stem cells can be used in regenerative therapy to produce new cells for disease organs, such as in the cases of heart failure, even spinal cord injuries and neurodegenerative conditions such as Alzheimer's. Now, although there have been promising results, I think much of the research in these areas are still on an experimental basis.
Dr. Tan, being an obstetrician and a gynecologist, would you advise couples to donate cord blood to a public or private bank? Private, obviously, if they can afford it.
Well, as I mentioned earlier on, well, it's not compulsory, right? It is an option for patients to consider. And we recognize that there are some uses for these stem cells, right? But I think at the end of it all, it is a very, very personal choice. And it depends on how the families, how the parents view the process itself, all right? There are some parents who are more, on an altruistic kind of intentions, right? So for these parents, they decide, okay, I'm just going to donate the cord blood and see, whether I can help anyone in case if a match can be found, right? There are some parents who prefer to keep it in, particularly now that many of us are having not many children overall. We are having small families, and knowing that there's a likelihood of finding a match amongst siblings, right? So some families may choose to keep for their own use, right? Just in case, right? In a way, it's like a biological insurance. Just in case, you hope not to use it, right? But in the event if you really need to use it, then hopefully the stem cells that are collected might match one of the family members or siblings that may need the therapy.
You mentioned, of course, primarily used for a lot of pediatric cancers, and that there has been some initial research into other uses as well. But I'm curious, in the research hospitals, I get it. It's wonderful to have that resource there in the event that it is necessary and needed and other people are able to tap onto it. But for those that are storing in a private capacity, I'm curious, what if it's only for their own personal use, their own family use in that regard? You would not need to store it beyond the teenage years of that child within the family. I would imagine you wouldn't keep it more than 20 years in that sense.
I think the majority of the cord blood banking arrangements are meant for until the child reaches 21 years old of legal age. And I believe some companies would then ask, these children, since they have become adults, whether they want to continue with actually storing the samples. So in that sense, and also by then they have actually exited childhood. So the question is, are these cells of any use to them? And I mean, as a lot of research is actually going on at this current moment, right? We may not have any use for these stem cells at this current point in time, but there's no telling whether in 10 years and 20 years, right, whether some new technology, some new research might have actually come about, which may then, possibly show that, these cells can be used for other conditions in the future.
But we're still looking at, when you're talking about these stem cells as well, it's just a limited cell dose, yes? Just a small volume of unit, yes?
Yes, yeah. So I think there's a limited number which they harvest. But I think, to be fair, I think, the cord blood banking companies and the people involved in stem cell research are probably in a better position to give a better answer.
And harvesting it from the umbilical, no issue, right? No pain, no damage, no harm to baby and mother from doing this, right?
Yeah, so I mean, there are a few criteria that we need to fulfill before we collect the cord blood. So I think the baby must be of a certain gestation, usually at least above 34 weeks of gestation. So we don't want to harvest blood from babies that are too premature. The second criteria is that there must be no danger to the mother or baby when we collect this blood, and the baby has to be delivered safely first, right? And the blood has to be harvested while the placenta is still connected to the mother's womb, right? And then what will happen is that if all these are the criteria that we have fulfilled, then as a doctor, what we will do is that we will clamp and then cut the umbilical cord. so that the baby can be, carried off. And then what we do is that we will clean a segment of the umbilical cord, right? So we sterilize, we clean it before a needle is actually inserted into the vein within the umbilical cord itself. And then the blood is then drained into a specially prepared collection bag. And the bag, along with the blood samples taken from the mother, is then sent to the cord blood banking facility for processing and storage.
Got it. Okay, final point before we let you go. Like you said, the awareness of this technology and this science has been around since the 1960s. And there has been evidence in terms of some of the blood cancer treatments, as you mentioned earlier on, with leukemia, primarily around that, the evidence base there. But is this a widely practiced healthcare issue around the world, to your knowledge? Is this very quite common to have both public and private storage of this? Or is it, like you said, insurance that we don't know, it might be beneficial in future or it might not?
I think there's a lot of controversies depending on the legislation of different countries, right, with regards. I just spoke with a colleague earlier on with regards to this topic itself, and he told me that basically, as far as he is aware, that in the EU itself, right, there's no private cord blood banking, right, from what he's aware of, right, and basically it's only public registries that are available, right, but I think certainly in different countries, in Singapore, we do have private cord blood banks that are available, so there is a lot of controversy still, right, despite technology having been around, and the with regards to the approach, right, whether it should be a public registry, right, whether there should be private banks available, so I think it's quite still debatable, right, as to how these models should be run in different places.
Dr. Tan, this has been fascinating. Thank you for reminding our listeners about the nature of cord blood itself. Appreciate your time. Dr. Tan Eng Loy is an obstetrician and gynecologist from EK and EL Women's Clinic. This has been Singapore Today.